Hello, welcome, and thank you so much for joining tonight. The Ask the Experts virtual event, Your Eyes, a Window to Your Health. I'm Dr. Nicole Bayich, a comprehensive ophthalmologist and a cataract surgeon at Cleveland Clinic. And joining me today are one of our fellow optometrists and two ophthalmologists at Cleveland Clinic. Cole Eye Institute is comprised of a multidisciplinary team of doctors who provide expert management of eye and vision conditions, serving locations all across Northeast Ohio. We specialize in the entire spectrum of eye conditions, handling everything from the most common to the most complex, from your annual vision checkup to sight-saving surgeries. And we're here tonight to help answer your questions, share our expertise, and provide clinical insights on the importance of routine eye care and annual eye exams, how to maintain good vision and keep your eyes healthy, when to see a doctor for floaters, flashes, and other eye issues, and how other health conditions affect the eyes, like diabetes, high cholesterol, and etc. We've had more than 185 questions for tonight's event, so we'll try our best to answer as many as we can. We'll also send out an email after the event that includes eye health resources. But before we get to our questions, I'd like to let the panelists take a few moments to introduce themselves. They'll each share a little bit about their backgrounds and answer the question, what is the one thing you do in your daily life to take care of your eye health? So to kick things off, again, I'm Dr. Nicole Bayich, a comprehensive ophthalmologist and a cataract surgeon at Cleveland Clinic, and also tonight's moderator. I've been practicing for 6 years now, and I see patients mainly in Independence, but come January, I will also be seeing them at main campus. And my area of specialty is cataract surgery. And as for one thing I do in my daily life to take care of my eyes, aside from eating a healthy diet, I actually will do warm compresses every day, and I have the whole family hooked. So even my 3-year-old, she'll get her little eye mask after we pop it in the microwave, and she's very insistent on doing it as a part of her daily routine. So next on the panel, I'd like to introduce Dr. Lamorgese.
Good evening. My name is Alex Lamorgese. I'm an optometrist here at the Cleveland Clinic. I've been in practice for a little over 3 years now. My primary office locations are in Westlake, and I also see patients out in Elyria at Chestnut Commons. I'm an optometrist, so I specialize in just comprehensive eye care. I see routine eye exams for adults. I do a lot with different types of contact lenses and fitting contact lenses for patients with different corneal disease and corneal transplants. And I also help to co-manage a lot of our cataract and some corneal cases with a couple of our surgeons here at the clinic. As far as what I do, I am a big sunglass wearer. I think it's really important to wear your sunglasses. So I pretty much can't find me outside when the sun's out without my sunglasses on.
Great. Well, thank you so much. Next, I would like to introduce Dr. Mary Q. So please tell the audience a little bit about yourself.
Hi, everyone. My name is Mary Q. I'm a glaucoma specialist. I'm in my 6th year of practice, and I actually did my glaucoma training here at Cole Eye Institute 7 years ago. I see patients at the main campus for glaucoma. So anybody with high pressure in the eyes, or maybe even a family history of high pressure in the eyes, or maybe another eye doctor told you that your pressure was high, or that maybe you're suspicious for glaucoma, those are things that I can help you with. As for something that I do every day to take care of my eye health, I use artificial tears about twice a day, preservative-free. So I keep those in my bathroom, and I use them morning and evening just to keep my eyes feeling lubricated.
Very good, Dr. Q. Next, I would love to introduce Dr. Alexandra Rachitskaya.
Thank you, Nikki. It's great to be here with you today. And my name is Alexandra Rachitskaya. I'm a retina specialist. I see patients at main campus and also on the east side. I see patients at Hillcrest and in Beechwood. And as a retina specialist, I do a lot of things that pertain to the back of the eye, the retina. I see patients with such conditions as macular degeneration or diabetic eye disease. And I also treat patients surgically for such conditions as retinal detachments or macular holes or epiretinal membrane. So I'm the kind of doctor you don't necessarily want to see, but if you need to see me, I'm happy to help out. And I've been in here at Cole Eye Institute for 10 years. It's been a great time, and I'm so glad to be joined today by my fantastic colleagues. And I'm like Alex, I'm a big believer in sunglasses. I think, I see a lot of patients with macular degeneration, and we know that sun exposure is one of the risk factors. So sunglasses or a hat is really important, I think, when it comes to taking care of your eyes. And I look forward to today's discussion.
I bet you also eat your dark leafy greens too.
Mediterranean diet, absolutely.
Very good. So now that you've gotten to know our panel a little bit, it's time to answer your questions. Again, we've received over 185 questions regarding vision conditions like dry eye, macular degeneration, and glaucoma. So we'll attempt to answer as many as we can for the next 45 minutes. Okay, so let's see. First question we have here is going to Dr. Q. And then anyone else who'd like to chime in. What are the warning signs to look for in the eyes with aging? When should you be concerned by symptoms, for example, with increased floaters?
So as you get older, there are a lot of things that can change about your eyes. Sometimes you might notice that your vision is getting blurrier, or maybe there's missing spots in your vision or fogginess in your vision. Some of those things can be due to reasons that are reversible. For example, cataracts are reversible, but other things that cause vision loss like glaucoma are irreversible. So you're not necessarily going to know what it is unless you go see an eye doctor. Flashing lights and floaters are something different. Those happen in the back of your eyes, and that's something that you might see Dr. Ratcheskaya for. You might also notice wiggly, wavy lines when they're supposed to be straight, for example, and that could be something wrong with the macula. So anything about your vision that just seems a little bit off, if it's not going back to normal, you might want to see an eye doctor about that. And there are other things about your eyes that can just feel weird, like your eyes might be painful or dry or something. So again, if you see an eye doctor, we can help tell you what's wrong and how to make it better.
I would totally agree with that. And I think another important thing is to make sure that you get your regular eye exams, because a lot of things that we can see inside the eye might not be obvious. You actually might not have any symptoms and have a serious problem that's starting to develop in your eyes. So getting your annual exams, making sure that somebody looks in the back of your eye and checks for any conditions such as glaucoma or diabetic eye disease, if you're a diabetic, is extremely important, because sometimes your symptoms might not come on until the disease is very advanced.
That's a great point, Dr. Ratcheskaya. Like glaucoma, we call it the silent killer of vision because the vision loss starts from the outside in. So you truly don't know until it's too late, which does remind me that I am overdue for my annual exam. So I will probably be coming to see you in clinic very soon. Okay, great. So let's see. Our next question here is for Dr. Lamorgese. How can eye health interact with other conditions throughout the body?
Yeah, so this is a great question. We kind of alluded to it already with, our opening question, talking about a lot of the reason that you should be seen annually for eye exams to determine, what's going on with the overall health of the body. The eye is really the only place we can directly view the blood vessels and the vasculature in the body with a dilated examination and look at things or the status rather of, diabetes, hypertension, high cholesterol. These sorts of issues can easily be, present in an eye exam that you check. And if you're not seeing your routine, primary care doctor every year, it's important that you see us as well. So that way we can kind of determine if there's these sorts of issues we can, detect early on.
Great. Thank you so much. Okay, so our next question is actually one for me. What, if any, technological advances have there been in the area of cataract surgery? What are the options available to someone who needs cataract surgery? So it has never been better to be a cataract surgeon because we have truly the most incredible technology at our fingertips. Regarding the various advances, I mean, we have everything from now our microscopes, which we use to perform the surgery. We can have them 3D, which is incredible. We also have laser-assisted cataract surgery, which we've had for some time, but there's constantly new advancements being made to make it, even better year to year. With regards to the patient perspective, there have been significant advancements in advanced lens technologies. So, for people who are currently looking to have cataract surgery done, you might be very overwhelmed by the many options. How I typically break it up to patients are, we have the lenses insurance covers and the lenses insurance doesn't cover. And then out of the, premium lens options, we have lenses that correct something called astigmatism. And astigmatism is basically a fancy word for your eye's not perfectly round. It's a little bit oblong. And so astigmatism correcting lenses are custom lens implants that kind of address that and help sharpen your vision. But then we also have the multifocal lenses, which these are the lens technologies that you're going to want if you're interested in having an extended depth of vision. So if you want to have, distance vision, intermediate, and reading vision, and really limit your dependence on glasses, that's going to be the lens that you're going to be interested in learning more about. However, it is really, really important to make sure that you're an appropriate candidate for those lens technologies, especially with the multifocals, because not everyone's a candidate. And, it does have a side effect profile like glare and halos, and it can decrease contrast sensitivity. So it's really, really important that you have a very careful eye exam and make sure that you don't have any conditions like retinal conditions or glaucoma that could preclude you from having that lens technology, or also dry eye. So there's many different options now, and with the multifocals, there's constantly new advancements being made year to year. So it's prudent to make an appointment with a cataract surgeon that is well versed in all of the newest technologies. Okay. Don't know if anyone else wants to chime in here. If not, we'll go on to our next question. So how does macular degeneration occur, and is it genetic? And this is for Dr. Rachitskaya.
So thank you for that question. I think macular degeneration is one of these conditions that if somebody hears they have it, or they hear somebody else in their family might have it, it can be quite scary. There is a lot of information on macular degeneration that you can find online. And I think it's very important to understand that macular degeneration is a condition that exists on a spectrum. There are some patients who have very mild macular degeneration and some patients who have severe macular degeneration. When we think of the reasons why somebody would develop macular degeneration, there are some factors that we cannot modify. One of these factors is genetics. We know that there's a genetic component to macular degeneration. It's not a single gene, so it doesn't mean that if your parent has it, you will for sure have macular degeneration, but it is a risk factor. Additionally, we see macular degeneration with time. It's very uncommon to see macular degeneration in somebody who is younger than, let's say, 55 years. And as time goes on, folks are more likely to develop macular degeneration. The other reasons why somebody might develop macular degeneration and have more progressive macular degeneration are more in our control. So we alluded to these things before, and I get asked a lot in clinic, I might see somebody who has a family member with advanced macular degeneration, and the question is, what can I do to minimize my risk? Well, we can't control our genes. We can't control our age as much as we would love to. And so the things we can control is we know that Mediterranean diet has been studied and is actually something that's been shown to protect our eyes when it comes to macular degeneration. So green leafy vegetables, salmon is something that we can all incorporate in our diet. Then avoiding smoking and secondhand smoking, which is luckily we see less and less of, but there's still smoking that happens. Sun protection is very important, whether it's with sunglasses or wearing a hat. Even in Cleveland, where it seems like now it's getting dark at 3 p.m. It feels like that at least. It's good to exercise good habits. And when it comes to macular degeneration, like I mentioned, there's different types of macular degeneration. So not all macular degeneration is the same. You can have very early macular degeneration, intermediate macular degeneration, and then more advanced forms of macular degeneration as well.
Very good. Well, thank you so much, Dr. Rachitskaya. Okay, so next we have a question for Dr. Q. What is glaucoma, and can we rely on our annual eye exam to check for it? Are there any symptoms to watch out for?
Glaucoma is when the pressure in your eye is too high for your eyeball to be able to handle. And as a result, the connection between your eyeball and your brain, which is called the optic nerve, it can get damaged from that pressure. Sometimes this happens when the pressure is extremely high, way higher than would be normal. And when the pressure is very high, you can rely on your annual routine eye exam to catch that high pressure. Because when you see somebody for your normal eye exam, they always measure your eye pressure. But sometimes the pressure is not that high, or perhaps you have had LASIK or something else that might make it so that your pressure just reads a little bit low. And so in those situations, an annual eye exam might just measure that your pressure is normal and it might not catch a high pressure. In those cases, sometimes your doctor would look into the back of your eye and actually look at your optic nerve. And so when your optic nerve is being examined, there are some changes to it that can happen that might be suspicious for glaucoma. For example, the tissue there just doesn't look as thick as it normally would. It looks like perhaps some damage has happened. So then your doctor might say that we're suspicious that you might have glaucoma based on how your optic nerve looks. Even if your pressure is not that high, you should maybe go see a glaucoma specialist to have that looked into. And then you would get a more thorough eye exam with a glaucoma specialist to look at your pressure and your nerve and your eye visual function with a visual field test. And after all that, we would tell you whether or not we really thought you had glaucoma. So overall, glaucoma is a nerve problem that is related to pressure, but it's not 100% the pressure. And most times we would catch a high pressure, but sometimes it can happen even with normal pressure. So it's important to get your eyes checked, not just the pressure number. It's important to get dilated so someone can look all the way into the back of your eye and actually see your optic nerve. And hopefully if there's something suspicious going on, you can know to go see a specialist to have it looked at further.
Very good. Thank you so much. Okay, our next question is for Dr. Lamorgese. Can diet and eye vitamins improve eye health?
Yeah, thanks, Dr. Bayach. So as Dr. Rachitskaya had kind of already talked about with macular degeneration in the Mediterranean diet, so that is definitely a great diet for the eyes, high in omega-3 fatty acids. Lots of leafy greens, colorful fruits and vegetables are very important in our eye health. In protecting the macula with the pigments that are available in the macula, those types of foods can help, increase that pigment that's in the macula and keep them healthy, and protect you from macular degeneration in the future. Not only are the diet and the supplements important in that sort of realm, it also is a big topic in dry eye. So you'll hear oftentimes doctors or patients with dry eye talk about omega-3 fatty acids or fish oils as well. And it's actually a little bit of a topic of debate at the time with a lot of different docs out about omega-3 fatty acid supplements and fish oil supplements for dry eye. So I personally don't recommend them a ton unless the advanced dry eye is out there. I usually counsel my patients on increasing their dietary intake in these sorts of foods with like salmon and fish, different oils, walnuts and flaxseed oils are really rich in those sorts of vitamins and minerals. So that's something I talk to you about. It'll help with dry eye as well as, helping with, protect the eyes from macular degeneration in the future. Exercise and diet are also really important to, our patients. A lot of times we have other systemic issues like hypertension, high cholesterol, or diabetes. And just, maintaining good health overall, is very important in maintaining the health of the eyes as well.
Excellent. Thank you so much. I will add that the National Eye Institute did a large study, and they did not find a statistically significant improvement of dry eye with fish oil. However, there is literature to support the use of fish oil specifically for digital eye strain. And so many of us are, constantly on the computer or some sort of screen. And, I think that it's definitely underdiagnosed. And so if you're on the computer a lot and you struggle with dry eye, I think that you're going to benefit more than the average dry eye patient. Okay, next question here is, when is cataract surgery recommended? And this one's for me. So I recommend cataract surgery to any of my patients who have visually significant cataracts. What does that mean? Well, that means that their vision is no greater than 20/50 or degrades to that with bright light. And so in addition to that, I want to hear that the patient is struggling with some aspect of their daily life. So their quality of life is hampered by their vision. And if it looks to be primarily due to cataract, then I recommend cataract surgery. However, it's an elective procedure. And so, if someone's not bothered by their vision and they're doing well and they're not driving and having any issue, it's okay to watch. However, sometimes I gently will encourage my patients to start thinking about when they want to have that done, when it starts to become more advanced, because I like to do easy surgery. It's my favorite kind of surgery, and my patients agree. So the way I explain it is every single person on this planet will need cataract surgery if you live long enough. And so, in the interest of decreasing the risk of complications, it's better to do it in that sweet spot where it's significant, but not it hasn't been let to become too advanced. Okay, so our next question is, a question to Dr. Lamorgese. What would cause vision to blur and correct itself at different times throughout the day? And is this cause for concern?
So to answer the second question first, most of the time, yes. If you're having any type of blurred vision that's changing or fluctuating, I think you should come in and have us take a look just to see what's going on, especially if it's new and you're not used to it. A lot of different things actually can cause this sort of thing to happen. First thing that comes to mind is dry eye. Our eyes dry out the most when we're sleeping, and usually a lot of people complain of some dryness in the morning, or as the day goes on and you're on the computer doing your tasks all day, we tend to dry out as well, and you're more dry or more blurry at nighttime. So that's one thing. The next thing I think of, a lot of people complain of is, nighttime blurriness, or my vision's blurry when it's raining. And a lot of that is caused by uncorrected astigmatism, which we can correct with glasses or contact lenses pretty easily. There's other, corneal diseases that can cause these sorts of things to occur, different things in the eye, cataract, different type of cataract. So ultimately, if you're having any of these symptoms, I would recommend an eye exam just to get a good comprehensive look at the eye and see what's going on, and we could do something to help you.
Very good. Thank you so much. Next question is for Dr. Rachitskaya. What are eye floaters, and are they dangerous?
So eye floaters is a very common complaint that some might have. And the tricky part with eye floaters, just like with a lot of other eye conditions, you're kind of getting a theme here that it's important to take a look because eye floaters could be benign, or they could actually be a reason for concern. Most commonly, the eye floaters are related to the vitreous jelly that we have inside our eyes. And with time, the jelly starts moving, it's changing its consistency, and you can suddenly get this increase in floaters. Some patients describe as if they're seeing clouds, or they might be seeing like little dots, like as if somebody took a pepper shaker and shook it up, or people are seeing spiders or medusas. It's up to your imagination, really, how the floaters appear to you. And in those cases, they can also be associated with flashes of light. So when you have an acute onset of floaters, you were fine, and then suddenly you have a lot of floaters, it's a good reason to have your eyes dilated so we can look at the back of the eye, the retina, and make sure there's no associated problems that can happen as the jelly inside moves. it's something called posterior vitreous detachment or posterior vitreous separation. When the jelly inside the eye moves, it can pull on the retina and can create such problems as retinal tears and retinal detachment. Some patients have more chronic floaters, and if it's a chronic floaters, you should definitely have your eyes checked as well. But it's the acute change, a sudden change from your baseline when you were okay, and then you have these new symptoms that should prompt a more urgent visit. Floaters can be, though, from many other causes. If you are diabetic, for instance, you can have a bleed in your eye and it will appear to you as floaters. And also, if you have inflammation in the eye, such as uveitis, you can have floaters. So the beauty of being an ophthalmologist, as I think Alex has alluded to, we have ability to look in the eye and see with our equipment what is going on. As a patient, you experience symptoms, and I think in general, the rule of thumb, if you have new floaters, new flashes, or any shadows in your vision, you should have your eyes dilated and make sure that the retina is stable.
Just to piggyback off that, do you ever recommend treatment for floaters?
So that's a fantastic question. So floaters can become very bothersome, and especially if it's your dominant eye, they can be quite significant. And majority of floaters, those acute floaters, when people come in, they're extremely bothersome because you're looking at a screen and you see this cloud coming across, or you're looking at a white wall and it's so prominent. Majority of floaters do get better. It does take some patience. It's not something that's going to improve overnight, but as long as the retina is stable, the floaters will get better. There is some patients, a very small majority of patients actually, that might require some more additional interventions, such as surgery to remove the floaters. The reason why it's such a small number of patients, because the surgery has risks. So it's not something that we take lightly, and we want to make sure that it's something that is done for the patient, for the right patient. And there's so many variables that go into that decision making that a retina specialist makes with the patient, depending on other things that are going in the eye. Is the eye already had cataract surgery? Is there any other retinal disease that might affect the outcome or put a patient at a greater risk? So there is potential surgery to remove the floaters, but it has to be a very thorough discussion with the patient, potentially patient's family, and the doctor to make the most educated decision. It's not something that is to be taken lightly. Like I mentioned, it's a surgical intervention, and any surgery has potential risks.
Very well said. Our next question is for Dr. Q. What are the most effective medications for glaucoma currently available?
That's a great question. In the last few years, there have been more and more glaucoma medications that have become available to glaucoma patients. Years ago, there was only maybe one eye drop or two eye drop options. Now there's 5 different classes of eye drops that patients can use. And within each of the classes, there's multiple options too. Some of them are generic, some of them are brand name, some of them have more chemical preservatives in them, some of them have gentler preservatives, some of them have no preservatives. And so there are a lot of different types of eye drop options that range in efficacy and range in price and range in side effect profile that you can talk to a glaucoma specialist about to see which one might be the best one for you to start with. If you're already on some eye drops and you're having some trouble with side effects with certain of the eye drops, you can try switching to a different class or switching the type of preservative or switching how many times per day. So there's a lot we can do with those particular eye drop options. There's also pills that help lower the eye pressure. Those are a similar class of medication as one of the eye drops. We don't usually like to have patients taking pills long term to control their eye pressure because the pills go in your body and affect all your other organ systems too, and can sometimes give you other side effects like problems with your kidneys, for example. But sometimes we use pills to lower eye pressure, especially for a short period of time to get through an emergency situation, or if we're just waiting for surgery, or because we can't have surgery and so we just need to buy some time. There's also a new class of medications that are coming out that are sustained release. And so there are some options where you could have a little pellet of medication injected into your eye that would last for a longer time. So that's relatively new. It just came out several years ago. And so some glaucoma specialists are offering that option as a medical treatment for glaucoma, which is basically all these treatments lower eye pressure. So whether it's an eye drop, a pill, or an injectable medication, all of these glaucoma medications work by lowering the eye pressure so the pressure does not damage your optic nerve as much.
Very good. Thank you so much. So this next question is for me. Please explain the pros and cons of multifocal lenses for cataract surgery. When I discuss the pros and cons of multifocal lenses with patients, I focus on number one, the side effect profile. You really need to be aware that it can cause glare and halos. So if my patient does a lot of driving at nighttime, or if one of their biggest complaints with the cataract is glare and they're extremely bothered by it, I definitely take serious pause when considering, a lens like that for them. It can also decrease contrast sensitivity. So, again, it's really important that there are no other concurrent eye conditions that could, make that lens not function as well. I want to make sure that, patients are able to see as clear as possible. And so one of the other things I discuss is that although the lens technologies are fantastic, they're the best they've literally ever been, it's not perfect. You're not replacing Mother Nature. Nothing we have can replace Mother Nature. But, if the thing that's most important to you is the convenience and being able to be more free from glasses in your day-to-day activities, that is the best potential option. That said, there are also other potential options such as monovision, which that's something we set up during cataract surgery where we make one eye set for distance vision and the other eye set for near or reading vision. But the downside is you lose your depth perception with that, and not everyone tolerates it. And so, you have to really have a nuanced discussion with your surgeon about what options may be best for you. There are also a different lens class called extended depth of focus lenses, which it's like a gentler version of the multifocal. And these lenses I'm actually a big fan of, especially, for someone who has reasonable expectations. But you can actually get, very good reading vision, and the side effect profile, in my experience, has been very good. But again, that's if you are the appropriate candidate for it. So I think it's really important that you have, a nuanced discussion after having a careful dilated eye exam with your surgeon. Okay. So our next question is for Dr. Radzhitskaya. Are there any new developments on the horizon for treating macular degeneration?
So I'm very glad you asked this question, because macular degeneration years ago, especially as we got to advanced stages of macular degeneration, was one of these diagnoses where there wasn't much we could do. And I think a lot of patients might have family members who, grandma couldn't see because grandma had macular degeneration, and eventually she stopped driving, and, it really affected her quality of life. We have a lot of new treatments. And I always tell patients that even in my career, I have seen things go from kind of an idea to going through clinical trials and becoming available for our patients. So when we think about wet macular degeneration, which is the situation where you have an advanced form of macular degeneration where there's fluid accumulating in the retina, and that causes distortion of vision and decreased vision. We know that the earlier we catch macular degeneration as it turns into wet and initiate treatments, the better are the outcomes. So we usually, when we see a patient with macular degeneration that is not wet yet, we give them a grid. It's called Emsler grid that you use at home to monitor your vision, each eye separately. And then if there's a change, even before your scheduled appointment to come in, you call and we can take a look. So if you convert to wet macular degenerations, we have many types of injections in the eye that we can now tailor more and more to a particular patient. The goal of the injections is to bring the swelling in the retina down, to improve vision, keep the vision stable, but also minimize the number of injections. So historically, we would start patients on monthly injections, and a lot of times patients had to be injected every month. Well, it's worth it if you can keep your vision, but it's a lot of injections. And, and people generally are not volunteering for eye injections. So there's more and more drugs we have where we can potentially extend that interval. It's very patient dependent, and I develop plans with each particular patient depending on their response and as we use these medications. But I think there's a lot of advancements. And there's more clinical trials where we're looking at medications that might control the swelling in the retina for even longer periods of times. Ideally, we would have injections that we have to give every 6 months. I mean, that would be fantastic, where you come for your injections twice a year. We're not quite there yet, but there's more and more development in that area, trying to minimize the number of injections. I also will say, for people who are listening who've never experienced an injection in the eye, it sounds like such a kind of science fiction almost, getting an injection in the eye. But we do a lot of injections, and if you need it, it's something that we do as comfortably as possible, and it's done in the clinic. You don't need to go to the operating room for an injection. When it comes to the second subtype of advanced macular degeneration called geographic atrophy, we also have developments. It used to be that there was no treatments at all. The treatments were trying to find low vision aids to help those patients. And in the last couple of years, we've had two medications that have been approved by FDA for geographic atrophy. These are the first types of these medications. They're also injections, and they, at this point, do not stop the disease. They don't reverse the disease. They don't bring vision back, but they slow down the progression of the disease on average by 20% at 2 years with injections every month, more or less. It's a very individual decision who would benefit from these treatments. So it's something that depends on what each particular patient's eyes look like, what their imaging looks like, what their history is in terms of the progression of the disease. And so we have the discussion with each patient if it's something that's beneficial for them. And we also discuss potential side effects of these injections and kind of talk about safety issues. So there's a lot that goes into that discussion. I guess to summarize, it's I'm just so excited that we have treatments, and I think we're going to have many more treatments that will allow us to preserve vision for patients, potentially improve their vision, and require less frequent treatment. So that's what we're working for when we look at research in age-related macular degeneration.
Thank you so much. Okay, our next question is for Dr. Lamorgese. Can dry eye lead to other problems in the future? And what is the best treatment?
Yeah, so this is a great question because dry eye affects a large number of people, especially as we grow up. And now that we're using screens and our computers and our phones a lot more often, not blinking as much is definitely leading to eye strain and dry eye symptoms of feeling like your eyes are burning or gritty or just irritated all the time, or your vision isn't right. So to answer the first question, can dry eye, lead to more eye problems down the road? So the first thing that comes to mind is you're going to have with dry eye that's chronic, probably just inconsistent vision. You get new glasses and you come in and you say, my glasses just aren't working. My vision's good at this time, but then it's bad after I'm reading for a while. So that will be one issue with the dry eye. Very severe chronic dry eye to the point where it's, untreated for a long period of time, and it very, very severe, can cause maybe some corneal scarring or damage to the surface of the eye that could lead to some, vision loss down the road. Usually, or hopefully, you'd come and see us before that happens, or, receive some treatment before it gets that bad. Same, you could get some very, dry conjunctiva. So the layer that lives on the surface of the white part of the eye, or actually inside and lines the eyelids, can get extremely dry and maybe scar up. Those are very severe cases. We don't typically see those too often, but just thinking about that. Now, as far as treatments for dry eye goes, this is a huge topic in industry. There's always new stuff coming out. There's a lot of a stepwise approach to a lot of the different types of treatments we use for dry eye. But the first thing that you should, your doctor should do is kind of determine the type of dry eye that you have. Your tear film is comprised of 3 different layers, basically a water and aqueous layer, a mucus layer that kind of lives on the surface of the eye, and then an oil layer that's secreted by the glands that live in our eyelids. Most people have kind of a multifactorial reason for dry eye, so they have maybe a little bit of aqueous deficient, or you're not producing enough tears, as well as an evaporative component to your dry eye where your lids just aren't working as well, or you have some inflammation of the eyelids. So like Dr. Bayach was saying, when she does her hot compresses, what that's doing is actually helping to express the meibum in the glands in the eyelids to produce a better oil layer on the surface of the tear film. What that does is it'll strengthen the oil layer of the tear film, so your tears are more stable. So you won't have to blink as often, and your vision should be more consistent when you have that. You're doing that sort of thing. So typically, when I see you for the first time and you're complaining of dry eye or watery eyes, I'll start you on hot compresses, and then we talk about preservative-free artificial tears, which are over the counter, just to lubricate and supplement the tears. And those I usually recommend preservative-free tears because most of the population we know now is actually allergic to, a lot of the preservatives we find in just over-the-counter tears and different ophthalmic medications. So I usually go to preservative-free tears as my go-to for baseline therapy. Now, if you're not getting better, doing tears and hot compresses, and you're, still seeking, more help, we do have that available to you. There is a large inflammatory portion of dry eye as well. And there's drops that help mitigate that inflammation. Sometimes it can be, short dose steroid drops to help with that, to get you feeling comfortable again, or a long-term therapy like you've probably seen commercials for Restasis or Xiidra or Cequa, which actually work to combat the inflammation and kind of stop it at its root and protect your eyes from that inflammation and keep the eyes feeling comfortable. Punctal plugs are another option. If you're not producing enough tears and really, using teardrops all the time, you're doing them 24/7. Those are basically little plugs that we place inside the puncta, which are the drainage structure in the eyelid. And it just helps to, keep a nice reservoir of tears on the surface of the eye for you. And then there's a lot of other options that are a little bit more advanced. We do, sometimes in very extreme cases, if those therapies aren't working, we can actually have you use autologous tears, which are basically serum tears. We draw your blood and have it spun down, and then the factors in the blood are actually regenerative to the surface of the eye. And those you can use to supplement the surface and make you feel more comfortable. That's usually in pretty extreme cases of dry eye that's not responding to other therapies. I think that's pretty comprehensive coverage. I don't know if you guys want to chime in. Dry eye is a big topic, and there's always new stuff coming out. So
I think you covered it. That was great. This next question could not be a more perfect question for Dr. Q. So Dr. Q, are there laser or surgery treatments for glaucoma?
There are. It depends on what type of glaucoma you have. Glaucoma comes in open angle and closed angle. Most people have open angles, which means the natural drain of your eye looks like it should be flowing, but it's just blocked on a microscopic level and making it not really flow all the way. So there is a laser procedure in the office called SLT laser. And that's a laser where we use light energy to go to the drain of your eye. And the light energy just encourages the drain to just drain a little bit better. So that's like pouring Drano down a sink if the sink is clogged to try to get it to be unclogged. Most patients who have open angle glaucoma for most types of reasons would be a good candidate for SLT laser. There are some types of glaucoma where that SLT laser would not be a good idea. So your glaucoma specialist could tell you more about that if you were not a good candidate. You also would not be a candidate for that type of laser if you had closed angle glaucoma. That would be like if you had a drain that was plugged because there was a stopper in the drain. So you wouldn't want to pour Drano down a sink that was plugged if there was a stopper in it. That's not going to work. And so if you have a closed angle type of glaucoma where you have scar tissue or something else blocking the drain, then you would not be a candidate for SLT laser. There are other types of surgeries that help the eye drain better. You can go to the operating room and have procedures that basically pour heavier duty Drano down the sink, the figurative sink, and also roto-rooter the drain. There are ways where we can put a catheter in the drain of your eye and kind of pull on the catheter to unclog some of the blockages. And we can also cut little parts of the drain to make it drain a little bit better. Also, sometimes patients with glaucoma, no matter what you do to their natural drain, it just doesn't want to drain. So there are other types of procedures that bypass the natural drain. So that's like I tell patients, your sink, you called the plumber, you tried the Drano, you tried the roto-rooter, that didn't work. So now you're going to go to Home Depot and buy new pipes and plug them into the sink. So in that scenario, we would be either plugging a new tube or drain into your eye to help the fluid drain out some other way, or we would be making a little trap door on the side of your eye so the fluid can flow out the trap door, or we would be putting a even thinner, another type of tube into the eye that helps the fluid flow out. So all of these surgeries either help the natural drain better or make another different way for the fluid to drain out of your eye. There are also surgical procedures that don't treat the drain at all, but instead turn down the faucet. So you could imagine if your sink was overflowing, you could just turn the water down. So if there are certain types of lasers that go to the part of your eye that normally make liquid and just makes it make a little bit less liquid. Some of these lasers can be done from the inside of your eye if you're having surgery for cataract surgery, for example. And some of these types of lasers are done on the outside of your eye, so they don't even require any cuts to your eye at all. There's also a type of laser for angle closure glaucoma, which is called a laser peripheral iridotomy, which is a completely different thing. And that would only be indicated in certain types of patients with a certain type of glaucoma. So you would have to ask your glaucoma specialist or your regular eye doctor whether you had that type of glaucoma before having a laser peripheral iridotomy. That would be less commonly talked about than the other types of lasers I've mentioned before.
Very good. Well, thank you so much. Our next question is for Dr. Rachitskaya. What treatments are available at the Cole Eye Center for inherited retinal diseases?
I think that's another fantastic question. Inherited retinal diseases is subgroup of diseases that, as the name implies, have a genetic component to it. And we at Cole Eye are extremely lucky to have a very robust team of doctors and geneticists taking care of patients for inherited retinal diseases. So we actually have an inherited retinal diseases clinic that is headed by Dr. Trabulsi, and he works with a genetic counselor to help patients who have this diagnosis. And it's another one of, it's kind of been a theme, I think, as we're hearing about different aspects from the cataract to glaucoma to retina, that there's so much innovation that's happening in the field of ophthalmology. And the same goes for inherited retinal diseases. There's gene therapy that's being investigated for a variety of inherited retinal diseases. And of course, it depends on what type of inherited retinal disease a patient has. So it's very important if you might have been told that you have an inherited retinal disease or that there's something that runs in your family, to make sure that you get evaluated, get appropriate genetic testing, and see if there's anything that is currently being done for your subtype of inherited retinal disease. There's one gene therapy that is approved by FDA, but it affects a very small number of patients. And there's other clinical trials that are going on for inherited retinal diseases, some of which we participate here at Cleveland Clinic. I'll just give a kind of a story to highlight how important it is to see an eye doctor, as there's so much that changes in the field of ophthalmology. I saw a patient who 20 years ago, maybe more than 20 years ago, saw an eye doctor and was told you have a genetic condition that is affecting your vision and you're going to slowly lose vision and there's nothing we can do. So the patient came to see us at Cleveland Clinic, and I said, well, who's your regular doctor? Who do you see on an annual basis? And the patient says, well, actually, I don't see anybody because I was told there was nothing to do. And it was so kind of shocking to me because now we do have options for this particular patient. And this patient wasn't given any hope. You know, they thought they were just, you know, gonna go blind. So I think it's very important to, even if you were told that you have a serious condition in your eye, check in, because there's always innovation. There's always, we're always trying to discover new things to help our patients with eye conditions. And if it's not now, maybe in the future, there might be something be available to you or your family members. So I would just encourage everybody, regardless if you are, you know, you have a healthy eye, make sure you get checked to detect things early and work on preventing any vision problems. Or if you've been given a diagnosis, and even if you've been told there's nothing that can be done at that time, check in and see if there's something new that is being done as it's happening in the realm of inherited retinal diseases.
Very good. Thank you so much. So our next question is actually for me. Since reaching my mid-50s, my eyes are dry and scratchy in the morning when I first wake up. Is this common? How can I make it better? So anytime I have a patient tell me that they have dry eye that they notice right upon awakening, I always ask a few questions. One, do you have a ceiling fan? And two, do you have a CPAP? Also, when you're waking up in the morning with pain, it's not uncommon for some patients to not close their eyes all the way while they're sleeping. And that little bit of space with the eye unprotected can really dry out over the course of the day. And especially if you have a CPAP or a ceiling fan blowing air, can cause a lot of dryness locally overnight. So one of the things I recommend to either get the CPAP refit, or you can put a little bit of Vaseline to just ensure a tighter seal. Maybe get rid of the ceiling fan, get a humidifier, and then you can use artificial tear ointment in your eye at bedtime just to help provide extra lubrication and protection overnight. Also, you can consider an eye mask. So our next question, it's also for Dr. Rachitskaya. What would you do if you see someone with damage caused by this solar eclipse?
So I think solar eclipse gained a lot of attention, you know, in this past year. And I think the most important message about solar eclipse is we want to educate about how to view solar eclipse safely and not see any patients with solar retinopathy. We were actually very lucky. I haven't seen much in terms of solar retinopathy after the eclipse that we experienced recently.
Our education worked.
Education works. I was actually gonna give a shout out to Nikki, because she was doing such a fantastic job, you know, educating in many different ways about protection. I mean, solar eclipse is so exciting. I hope all of you guys got a chance to experience it. It's actually, for me, much more impressive than I thought it was going to be. So it was really neat. But using the glasses with special solar filters is key. Making sure that those glasses come from reputable sources and that they're not damaged will really protect the eyes. The problem is, if there is solar retinopathy, once again, it can be very minor or it can be very severe, but there's not a good treatment. It's not like if you get solar retinopathy, you can just come to your doctor, get some drops or some pills, and go back to normal. Sometimes we can see irreversible vision loss. And the vision loss that's affected is the central vision. So it's the vision we use for driving, for reading, writing, you know, seeing faces. So I would highly recommend, if you're considering watching a solar eclipse, get the right equipment so you can enjoy that safely.
Great. Okay, so our next question, Dr. Lamorgese, how can fluorescent and blue lights at work affect eye health?
Sure. So I have a lot of patients ask this question as well. And it's, you know, new studies going on all the time about this because it's pretty new. You see probably a lot of marketing about blue light blockers and all of that jazz. So since we're on screens all the time, you know, the screens are emitting blue light, you know, TVs emit blue light, our phones emit blue light. So you probably see a lot of these blue light blockers, or you ask your doctor about that. a lot of the effects of the strain that you get, or your eyes just feeling uncomfortable from using these screens, is more of a strenuous activity. You get digital eye strain, as Dr. Bayach had, talked about earlier. And blue light glasses can mitigate some of that. A lot of them are, we're still kind of studying the effects of blue light and is it actually damaging to the eye. And there's not much conclusive research that's saying that it is truly damaging to the retinal cells in the eye. I don't know if Dr. Retchitskaya, Dr. Bayach, or Dr. Q, you could chime in on that. But what I always tell my patients is if it feels more comfortable to use them, please do. The one thing we do know is that it does affect our circadian rhythm. So if we use screens or exposed to a lot of blue light late in the evening, it may keep you up later. You may have poor sleep patterns. So that is something to take into account as well. I actually just read something that some soccer players in England are actually using blue light glasses by 8 p.m. They are, required to put them on to help with recovery for better sleep. So that's kind of cool. I think it's something new and exciting, and maybe some more will come out of that. And, is it actually better for recovery and whatnot? So
I think that was well said. Very good. Our next question, it was initially for me, but I'm actually going to ask Dr. Q to start off because it's perfect for her as well. Is cataract surgery safe for those with glaucoma?
That's a great question. And I also wanted to talk about the relationship between cataract surgery and glaucoma to piggyback off of your earlier answer about cataract surgery. Cataract surgery is safe for patients who have glaucoma, and sometimes during surgery, your pressure can go up a little bit, or sometimes after surgery while you're recovering and using the recovery eye drops, which includes a steroid eye drop, sometimes your pressure can go up a little bit. So if you have glaucoma and you need cataract surgery, it's important that your surgeon, of course, they'll know that you have glaucoma too, and sometimes they can take some special precautions to help make it so that your pressure doesn't go up as much as you're having the surgery and recovering from the surgery. Also, at the time of cataract surgery, there's a lot of minimally invasive glaucoma procedures that we can do at the same time that helps address the glaucoma as well. Most of these are procedures that work on the natural drain. So those are things on the spectrum of the Drano and the Roto-Rooter type of procedures. And so you can have those done at the same time as cataract surgery. And that doesn't have to be with a glaucoma specialist. Comprehensive ophthalmologists like Dr. Bayach also perform these minimally invasive glaucoma procedures. And so those could be a great option for you depending on what type of glaucoma you have. And the other thing I wanted to mention about the relationship between cataracts and glaucoma is that sometimes people have a type of glaucoma where the cataract actually makes the glaucoma worse. Those are types of glaucomas that are more called the angle closure glaucomas, meaning that your drain is physically blocked by something. So cataracts not only can become cloudy and blur your vision, but they can also take up space inside your eye. A cataract is about 5 millimeters thick and your eye is pretty small. So something that takes up 5 millimeters can just take up sometimes too much space and then push the drain of your eye to become more crowded. So sometimes what's needed in order to make more space in your natural drain is to remove your cataract. Sometimes even when the lens itself is not that cloudy. And so that would be one exception to the rule of, cataract surgery, you can just have it whenever you want. It's totally elective. It's totally up to you. Only when your vision is bad enough that it bothers you. There's a small number of people where the cataract, even though it's not that cloudy yet, the shape and size of the cataract can actually potentially be causing angle closure glaucoma. And if that were to be the case, then earlier cataract surgery might be recommended for you. So that's something that your doctor would have to check your drain and see if it is crowded or narrow, and then tell you whether your cataract might be interacting with your glaucoma in that way.
Perfectly said. Now we only have time for one last question, and this one was also to Dr. Q and the group. Please discuss what situations are considered an emergency and how to get emergency help on weekends, holidays, or off hours when needed.
Right. There are a lot of different types of eye emergencies that hopefully would be very rare, but it could happen to you. One of them might be a glaucoma emergency. So sometimes you might have sudden pain in your eye where the eye hurts and it's sore and the vision is decreased and it's red. That could be a sign that the pressure is high, or it could be a sign of something else like inflammation, for example. There are other emergencies that Dr. Retchitskaya mostly deals with related to the retina. You could have a tear or detachment of your retina. You could also have an emergency where you had some trauma happen to your eye, where you were maybe playing a sport and something hit you in the eye, or driving and had a car accident and something went into your eye, or any number of things. It's kind of amazing how many different ways there are for people to accidentally injure their eye. So if this were to happen to you, you have to go see an eye doctor right away. If it's the night and the weekend, you should come to our emergency room or the emergency room of any major hospital system, especially one that has a teaching hospital, because usually there are residents on call. So you would be seen day or night if you were having an eye emergency. So in the emergency room, an on-call doctor would examine your eyes and check to see how's your vision, how's your pressure, how's the front of your eye, how is the back of your eye, and what type of medication or surgery or subspecialty care might be needed. So no matter what day or time it is, if you think that your eye is hurting or the vision is significantly worse or you've had some kind of trauma to your eye, you can always come to the emergency room. If it's something that's not quite so urgent and it's like a normal daytime hour, you can call the ophthalmology clinic at Cole Eye Institute, and we have something called a same-day access clinic. So that would be for patients who are having a bit of an urgent problem and you can't just get in with a regular eye doctor because everyone's booked. We have eye doctors that see patients in the same-day access clinic, so you can still get seen for your urgent eye problem. This sometimes might be more useful than going to a general urgent care, because sometimes patients with an eye problem will go to a regular urgent care, but there's not the special equipment at an urgent care to necessarily look at the eye. So there's not as many microscopes and things like that. So going to an urgent eye center might help you diagnose the urgent eye problem a little bit better.
Very good. Well, thank you so much. So that was our final question of the evening and the conclusion of our Ask the Experts event. Thank you all so much for spending your evening with us. If you'd like to learn more or to schedule an appointment at one of our convenient locations across Northeast Ohio, please visit clevelandclinic.org/eye or call 216-444-2020. In the coming days, you'll receive an email with eye health related resources and details on how to make an appointment and a link to a recording of this event so you can view it again. Thank you all so much and have a great night.